Hi children, welcome. Welcome to today's social science class. Children, in this video, I am going to explain about public and private healthcare system, healthcare and equality, then about Costa Rican approach and about the Kerala experience. Public health services. The public health services is a chain of health centers and hospitals run by the government. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kinds of problems, from common illness to special services. At the village level, there are health centers where there is usually a nurse and a village health worker. They are trained in dealing with common illness and work under the supervision of doctors. At the primary health center PHC, such a center covers many villages in rural area. At the district level is the district hospital that also supervises all the health centers. Large cities have many government hospitals, such as the one where Aman was taken. Also, specialized government hospitals, such as the ones in Hakimsek stories. The health service is called public for many reasons. In order to fulfill its commitment of providing health care to all citizens, the government has established these hospitals and health centers. Also, the resources needed to run these services are obtained from the money that we, the public, pay to the government as taxes. Hence, such facilities are meant for everyone. One of the most important aspects of the public health system is that it is meant to provide quality healthcare service either free or at a low cost so that even the poor can seek treatment. Another important function of public health is to take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide healthcare facilities to all. The government must safeguard the right to life of every person. The court said that the difficulty that Hakim Sek had to face could have cost him his life. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. The court also said that it was the duty of the government to provide the necessary health services, including treatment in emergency situations. Hospitals and medical staff must fulfill the duty of providing the necessary treatment. Hakim Sheikh was denied treatment at various government hospitals. Therefore, the court asked the state government to give him the money that he had spent on his treatment. Private health facilities. There is wide range of private health facilities that exist in our country. A large number of doctors run their own private clinics. In the rural areas, one finds registered medical practitioners. Urban areas have a large number of doctors, many of them providing specialized services. There are hospitals and nursing homes that are privately owned. There are many laboratories that do tests and offer special facilities such as X ray, ultrasound scanning, etc. There are also shops from where we buy medicines. As the name suggests, private health facilities are not owned or controlled by the government. Unlike the public health services, in private facilities, patients have to pay a lot of money for every service that they use. Healthcare and equality. Is adequate healthcare available to all? In India, we face a situation where private services are increasing but public services are not. What is then available to people are many private services. These are concentrated in urban areas. The cost of these services is rather high. Medicines are expensive. Many people cannot afford them or have to borrow money when there is an illness in the family. In fact, barely 20% of the population can afford all the medicines that they require during an illness. Hence, even for those whom one might not think as being poor, medical expense cause hardship. It was reported in a study that 40% of people who are admitted to a hospital for some illness or injury have to borrow money or sell some of their possessions to pay for the expenses. The Kerala experience. In 1996, the Kerala government made some major changes in the state. 40% of the entire state budget was given to panchayats. They could plan and provide for their requirements. This made it possible for a village to make sure that proper planning was done for water, food, women's development, and education. This meant that water supply schemes were checked, the working of schools and Anganwadis was ensured, and specific problems of the village were taken up. Health centers were also improved. All of this helped to improve the situation. Despite these efforts, however, some problems such as shortage of medicines, insufficient hospital beds, not enough doctors remained, and this needed to be addressed. The Costa Rican approach. Costa Rica is considered to be one of the healthiest countries in South America. The main reason for this can be found in Costa Rican constitution. Several years ago, Costa Rica took a very important decision and decided not to have an army. This helped the Costa Rican government to spend the money that the army would have used on health, education, and other basic needs of the people. The Costa Rican government believes that a country has to be healthy for its development and pays a lot of attention to health of the people. The Costa Rican government provide basic services and amenities to all Costa Ricans. For example, it provides safe drinking water, sanitation, nutrition and housing. Health education is also considered very important, and knowledge about health is an essential part of education at all levels. Okay, children, let us wind up this video, and this chapter is also over. Now, this chapter you have to read many times and underline important points, then to all given facts. Okay, thank you. Thank you to listening my class.